Another intervention that I had yesterday, I had an infant with pneumonia, like a literal 1-year-old with pneumonia. The dose that was sent over was ceftonir 125 per 5, 2.5 mils daily. I asked what the patient's weight was. It was 21 pounds, so I figured out that that dose was wrong. It was half the dose what it was supposed to be. It's supposed to be 5 mils daily or 2.5 mils twice a day. So we dose ceftonir by weight. So it's either 14 milligrams per kilogram daily or 7 milligrams per kilogram twice a day. So either the provider meant to send in the 250 per 5 concentration and like dose it like 2.5 daily, or they meant to send in like 2.5 twice a day. Either or is after hours. I told the caregiver to follow up with the pediatrician, and then I dispensed the medication so they could at least get it started. And I explained what the dosing should be. Last intervention yesterday was I had a patient, or I guess a caregiver, picking up ibuprofen 800 and aspirin 81 twice a day. It was for clot prevention after a surgery. It was just a basic counseling point of you have to take the aspirin 30 minutes before the ibuprofen, or you will not get its antiplatelet effects. Or I guess 8 hours after, but I recommend it to take it, of course, before. 8 hours is a weird timing window, especially if you're on the aspirin twice a day or dosing the ibuprofen more than 2 or 3 times a day. So yeah, you need to take the aspirin before, because it's going to bind to the COX enzyme and then exhibit its antiplatelet effects. You need that for clot prevention. It's not good to not take it like that. So I think that was all 3 of my interventions for yesterday. Kind of wild day.